Good afternoon. Good afternoon, ladies and gentlemen. Now, this is coming to a very important part of the afternoon. Again, we've got a rather pleasant duty to undertake in the first instance, and then we have a very, very serious duty to undertake, which is our annual general meeting. Just to remind the delegates in the room, I hope you've signed in for the annual general meeting. If you haven't signed in, then we do need you to do that. You need a different voting slip later in the day. Hopefully that message was loud and clear. We'll come back and I'll ask you again just before that moment. But at this stage of the afternoon, as you can see from your agenda, we're going to move on to the admission of the roll of fellows. Now, do you want me to put my jacket on again? Yeah. And I might frock up for this one, so it, not so much, because these people look fantastic. And I might do that, but we get the chance to formally recognise the outstanding contribution by several of our colleagues. The AMA is one of the nation's most respected and influential voices in medicine and in health policy. When the AMA talks, people listen. This is due in no small part to the integrity, knowledge and judgment of leading AMA members that they've displayed when they're contributing to policy discussions and debates. Whether it be vaccination, hospital funding, drinking, gambling, Indigenous health, care for children or the elderly, obesity, smoking, hospital waiting lists, the AMA is turned to as the voice of reason. Each of the people being admitted to the roll of fellows today exemplifies all that makes the AMA such a trusted and well-regarded contributor to national health policy and debates. It's wonderful that we've got the opportunity today to show our appreciation for the outstanding contribution each one has made. And I'll just go and get the ceremonial gown on. Don't get to wear this for very much longer, so just keeping it warm for whoever succeeds me tomorrow, did I say? Sunday, okay, 48 hours. Just keep an eye on the President. All right, the first recipient of the award of fellowship is Dr. Alex Markwell. Oh, actually, come on. Let's do that. I'll say nice things about you.
Thank you.
I'll get Dr. Markwell to stay here. Dr. Markwell is an emergency physician at the Royal Brisbane and Women's Hospital and Greenslopes Private Hospital, has made a most significant contribution to the AMA at both the federal and state level since she graduated from the University of Queensland in 2002. Dr. Markwell has been a strong advocate for junior doctors and served as chair of the AMA Queensland Council of Residents and Registrars from 2005-2007 and chair of the Federal AMA Council of Doctors in Training 2007 and 2009. In these and other roles, she not only lobbied for an increased clinical training capacity, safer working hours, work-life flexibility and doctors' health and well-being, but backed this up with research and numerous publications, presentations and much time served on committees such as the AMC's Specialist Education Advisory Committee. She has served at both state and federal councils and several of their committees for most of her professional life, except for a short break where she completed her fellowship in emergency medicine, a FACEM. As president of AMA Queensland in 2012-13, Alex worked tirelessly, championing health education, health literacy and the improvement of the social determinants of health to reduce the burden of preventable diseases. This included trauma-related injury and death, infections including sexually transmitted infection and HIV, and lifestyle-related chronic conditions such as type 2 diabetes mellitus. As AMA Queensland President, she travelled extensively throughout Queensland to ensure the AMA maintained its contact and engagement with the grassroots membership of the profession. Dr. Markwell is a senior lecturer at the University of Queensland and enjoys teaching and mentoring students, junior doctors and emergency trainees, always leveraging these activities to increase the profile of the AMA and recruit and retain members. Dr Markwell is a most worthy meritorious nominee for the admission of the roll of Fellows, and another round of applause. The next recipient is Dr Stephen James Parnas. Come up to the stage. Dr Parnas is the one without the glasses. You have just as handsome. Okay, Dr Stephen Parnas graduated MBBS from the University of Melbourne in 1992 and joined the Australian Medical Association at the commencement of his intern year. During his undergraduate career, he became the first medical student to chair the Melbourne University Student Union. Dr Parnas commenced his career as an intern at St Vincent's Hospital, Melbourne, and later at the Royal Children's Hospital and Werribee Mercy Hospital as resident medical officer. He also worked as a senior resident in Dorset, United Kingdom, and as a registrar in general surgery at Sir Charles Gardner and Royal Perth Hospitals before commencing as a trainee with the Australian College of Emergency Medicine in 2003. Dr Parnas achieved fellowship of his college in 2007, commencing his consulting career at Bendigo Hospital, returning to Melbourne in 2009. He's now a staff specialist at the John Faulkner Private Hospital, a visiting medical officer at St Vincent's Hospital. Dr Parnas has a keen interest in medical education and training. He was senior tutor at the University of Melbourne in the Department of Anatomy and Cell Biology from 2000 to 2002, obtaining and later teaching in the Postgraduate Diploma of Surgical Anatomy. From 2007 to 2009, he was senior lecturer in emergency medicine at the Monash University's Bendigo Regional Clinical School. In 2006, Dr Parnas was elected to the AMA Victoria Board as Vice President, becoming President in 2012. At a national level, Dr Parnas was a member of the AMA Council of Doctors in Training from 2004 to 2006, and also a member of the Medical Training Review Panel of Australia. In 2010, Dr Parnas became the Victorian rep to the AMA Council of Salaried Doctors. In 2011, he was elected as chair and a member of Federal Council. In 2013, Dr Parnas was elected to the Federal Executive. Dr Parnas has made an outstanding contribution to the Australian Medical Association and is a most worthy candidate for admission to the roll of Fellows. The next candidate is Dr Stephen Gordon Wilson. Come up to the stage. Dr Wilson graduated from the University of Western Australia in 1983 and joined the AMA in April of that year. He worked in metropolitan Perth as an RMO before commencing in general practice in 1985. From 1987, Dr Wilson practiced as a GP in New South Wales before returning to Perth in 1992. He purchased his own practice in Bassendean, WA in 1996 and continues as practice principal in this very busy practice. In his own words, Dr Wilson has always practiced in the harder areas and the lower socio-economic climes, where the medical need is the greatest and where he can make the greatest difference. Dr Wilson's given outstanding service to the Australian Medical Association, having been committed to general practice activities within the association since 1998. His ongoing involvement with the AMA began with the membership of AMA WA General Practice Council, and he served as chair of this council since 2007. In 1999, Dr Wilson was elected as a member of AMA WA Council and continues as a council member. He served as Vice President from 2008 to 2011. Dr Wilson has served as a member of the AMA Council of General Practice since 2008 and is a regular and valued contributor to the Council's activities. He has represented general practice on a number of reference groups and committees, including the General Practice Collaborative Group, which produced the 2013 report, Supporting and Strengthening General Practice. Within the federal context, Dr Wilson has been an outspoken advocate for the need to find long-term solutions to the problems of severe GP shortages in regional areas across Australia. He's contributed significantly to highlighting the problems associated with the PCHR as it would function in general practice environments. He has taught many of his colleagues how to effectively computerise their practices and is currently a senior clinical lecturer at the University of Notre Dame Medical School. The exceptional contribution Dr. Wilson has made to the association and to its representation of GPs and their patients well merits the recognition of the association by admission to its roll of fellows. Please join me in congratulating Dr. Markwell, Dr. Parnas and Dr. Wilson on their admission to the AMA roll of fellows. Come over here, photo. Do you want plaques or no plaques? Yeah. Okay. Thanks. All right. Let's see if we can. Can you come in front of the lecture? Come on, guys. This one's going in the album. Make it happy. Excellent. Thank you very much. Thank you. Thank you. Congratulations, everyone. Thanks, Steve. Thanks, Steve. Ladies and gentlemen, Dr. Markwell, Dr. Parnas and Dr. Wilson. Now, before Dr. Parnas gets too far away, he may say a few words on behalf of the fellows.
Thank you, Steve. It's very humbling to stand here today having been nominated for this honour by my peers, but I'm equally honoured to speak on behalf of my dear friends, Steve Wilson and Alex Markwell. I have known Steve since my days at AMAWA in 2001, and Alex since we were both on the AMA Council of Doctors in Training around 2005. I think that says something in itself. We form some amazing friendships as a result of our AMA activism. So often they are enduring. They are based on mutual respect, a shared passion for the work of the AMA. I look around this auditorium and see so many friends who fit that bill. In the days before this national conference, I managed to find a little of that most precious of commodities, time. Time to reflect on the journey I have had in the AMA, and I know that Steve and Alex share these sentiments. Our involvement in the AMA was almost accidental. In my case, it was a grievance over the lack of recognition of my prior learning by a college. Within the AMA, I found receptiveness to my arguments, a shared passion for improving the system, and the expertise to prosecute the case. Over 10 years have passed since those days, and we have gone into bat on so many issues since then. What I can say is that for each of us, the passion has never waned, and the AMA is our medical home. If anything, we have become more effective leaders and contributors with the experience that we have gained. As doctors in training, and later with our expertise in general practice and emergency medicine, we have come to know the health system intimately. We understand many of its strengths, its weaknesses, and its quirks. Each one of us has come to know the vulnerabilities of being a patient, the frustrations and the fears that illness has imposed, and just how much gratitude we have towards the colleagues who have cared for us so well. I am sure it has made us better doctors. I must speak of our families, in particular our partners, my children, and all who have supported us as we have gone about the work of the AMA. They have been patient, loving, and so understanding. They have made many sacrifices in support of each of us, and they really are honorary members of the AMA. I close by quoting one of the greatest doctors of the 19th and 20th centuries, the Canadian Sir William Osler. His innovations in medical practice and education make their mark to this very day. I like to think that our association continues his work. He said, "To have striven, to have made the effort, to have been true to certain ideals, this alone is worth the struggle." Thank you for this wonderful honour.
Thank you very much, Dr. Parnas. It's an absolute privilege to have you serve in my executive, and I know the other two recipients very well, and I'd echo your thoughts. And I do echo your thoughts about gratitude to our families. Each one of us here probably hasn't got our family with us, except if you live locally, but it's something that they give up to allow us to do what we're passionate about to support our profession. So once again, thank you very much, Dr. Parnas, and can we just have a final round of applause for Markwell, Parnas and Wilson? Thank you very much. Okay, we are going to move on to a very important part of the afternoon. That is the annual general meeting of the AMA.